To be embodied means to be vulnerable to pain. Because of our physical nature, we're susceptible to viruses and bacteria, head-on collisions, slipping on icy sidewalks, random violence, heart attacks, bee stings, and tsunamis. Even if by some miracle we escape the pain associated with disease and injury, we must still face the pain of getting old and watching our body wear out. Pain is a fact of life. Our typical response to pain is aversion. We simply don't want it, and we seek to avoid painful experiences as much as possible. But as we've noted many times before, aversion is an unwise strategy for living. Because pain is a fact of life, feverishly trying to separate ourselves from it is tantamount to separating ourselves from life itself. Central to the mindfulness approach to pain is grasping the distinction between pain and suffering. In this tradition, pain is understood to be a name we give to a range of unpleasant sensations. What constitutes pain is highly subjective. What hurts one person may not hurt another. Researchers are studying possible ways to identify and measure pain objectively using medical imaging, but currently the standard practice remains asking patients to self-assess their pain on a scale of 1 to 10. Pain is usually an indication that some facet of our being requires attention. In those cases, of course, we should seek out any medical intervention that may reduce or eliminate the sensations of pain and address its root causes. In principle, the mindfulness tradition has no reluctance about using medication or other medical procedures to diminish pain. But it does urge us to use wisdom when so doing. Sometimes medication used to diminish pain can be addictive or can hinder us from seeking out the deeper causes of our distress. Sometimes medication and intervention is simply ineffective. In these cases, coping with pain by mindfulness is helpful. Mindfulness is perhaps an even greater ally in dealing with suffering. Suffering in this context occurs when the mind responds negatively to the sensations it identifies as pain. It's not always easy to distinguish pain from suffering. This distinction is important because the mindfulness tradition considers pain to be inevitable, an inescapable part of life as we know it. Suffering, on the other hand, is regarded as optional, and the mindfulness tradition affirms that we can greatly reduce the suffering associated with pain and even remove it altogether. In the case of pain, what generates suffering is resistance, which means wanting this moment to be other than it actually is. Resisting pain can take many forms. It can be responding with fear and panic, with anger and with hatred, all of which are types of aversion. All of these emotions express the desire to turn away from pain and distance ourselves from it. The more we resist the pain that is undeniably present in this moment, the greater our suffering. And the greater our suffering, the more likely we are to act in unskillful ways. The key to diminishing the suffering that we usually connect to physical pain is acceptance. Like anger, pain shows up at the door as an unwanted visitor. Acceptance means answering the door without fear or hatred. In the exercises that I'll describe shortly, we'll begin to work with our pain by learning to accept it for what it is, to greet it with compassion, and to inquire about what it may have to teach us. Reflect on whether turning toward painful sensations in complete awareness might serve as a better approach than turning away from it. See if allowing yourself to feel the pain fully eases some of the distress and removes some of the aversion you may have for it. Try to locate the place in your awareness where you are observing a person with pain rather than being a person with pain. Consider the role your conditioned thinking plays in your experience of pain. Think about the ways fear and hatred of pain may exacerbate your situation. Examine the lessons pain can teach us. In many instances, pain tells us to seek medical attention to alleviate a physiological problem. This is not always the case, however. The indicative value of pain is greatly diminished with intense chronic pain. Chronic pain can persist long after medical attention has been given. For chronic pain, medication is often ineffective or undesirable because of its side effects. Meditation, then, may become the best alternative to medication. As someone who lives with chronic pain, I can personally vouch for the value of meditative practices in easing the suffering associated with pain, and on occasion, the pain itself. My particular malady is cluster headaches, a form of vascular headache similar to but more intense than migraines. Cluster headaches usually occur daily for many months each year. The pain lasts about an hour and is totally incapacitating. The cause of the headaches is unknown and there's no cure. But fortunately, there are some medicines that can sometimes prevent the headaches and mitigate the painful sensations. But despite the chemical intervention, I must frequently cope using the techniques I've learned in mindfulness practice. Mindfulness has helped me to become less fearful of the pain. In the past, especially before I had any medicines for treatment, I'd become panicked by the onset of the headaches, knowing I was facing the prospect of an hour of excruciating agony. The fear, of course, only compounded my suffering. But mindfulness practice helped me to relinquish the fear by allowing me to calm myself and recognize the pain would not last. Pain, like everything else, is transient. The practice also helped me release my anger toward the headaches. I got furious because I knew the pain would interrupt my plans, and there was nothing I could do about it. I felt helpless. And I was mad because this was happening to me. When the headaches began, I am better able now to accept my situation in that moment and release my attachment to my plans. And because of the practice, I'm less inclined to feel pity for myself by thinking my situation is unfair. It's not unfair. I'm not so special that I should be exempt from pain. Throughout the world, at every moment of every hour, millions endure great pain. I'm no different from anyone else. Pain is a fact of life.